Coagulation forceps-sparing techniques for preemptive sealing of blood vessels during third space endoscopy procedures. These are the keywords for this manuscript. We have no disclosures. These are the equipments used, including upper GI scope, electrosurgical unit, and ESD knife. Large blood vessels are commonly encountered during endoscopic submucosal dissection procedures requiring careful management. ESD knife is effective for smaller vessels, but coagulation forceps is typically needed to preemptively seal large blood vessels. Frequent accessory exchanges not only disrupt the procedural flow but also increase the overall cost due to the need for additional tools. This video demonstrates several techniques for preemptively sealing large blood vessels using only knife. This picture represents coagulation of large blood vessels with high voltage modes. As can be seen here, high voltage modes are associated with rapid rise in temperature, which result in both cutting and coagulation effect. This results in disruption of vessel wall and breakthrough bleeding. Coagulation on actively bleeding site results in a scar formation and high resistance, which results in reduced transmission of current and reduced effectiveness of coagulation. This video represents breakthrough bleeding as depicted in the previous slides. High voltage modes results in disruption of vessel wall and breakthrough bleeding. For effective coagulation, the environment can be modified by either modifying the settings or submerging the target blood vessels under saline, by adjusting the distance or lowering the settings, or submerging the target blood vessels under the saline, results in slower rise in temperature, less cutting effect due to lower voltages and impedance. This results in effective pre-sealing of large blood vessels. This is the first technique that we demonstrate for pre-sealing of large blood vessel. In this technique, spray coagulation is applied at a distance from the blood vessel. The distance of the knife with the target blood vessel is carefully maintained so that rapid heating of the blood vessel is avoided, which in turn results in avoidance of disruption of the blood vessel. Care is taken not to bring the knife too close to the blood vessel. Here we can see that ESD knife and spray coagulation mode are being used for slow coagulation of the blood vessel. Importantly, the spray coagulation is applied at the base of the blood vessel where it's arising from the muscularis layer. Minor breakthrough bleeding may occur, which can be easily tackled with the same coagulation mode. This prevents the use of coagulation forceps. In the second technique, we describe the underwater coagulation. Of note, it is actually under saline coagulation because the vessel is submerged under the saline. After submerging the blood vessel under the saline, the target blood vessel is opposed closely to the shaft of the knife and spray coagulation current is activated. Several applications are required, and of note, this mode of coagulation is usually slower as compared to the conventional soft coagulation. Submergence under saline results in rapid drop in voltage as well as impedance. This in turn results in slow coagulation of the blood vessel and avoids premature disruption of the vessel wall. The endpoint of underwater coagulation is complete blanching of the blood vessel and absence of any pulsatile flow. Once complete blanching is achieved, the saline is suctioned and the vessel is dissected using the same spray coagulation mode. Here we can see that after complete blanching, the vessel is being dissected by spray coagulation. In the third technique, we use modified settings which are lower than conventional coagulation settings. Here we are using the shaft of the knife which is closely applied to the vessel, and the settings are typically lower as compared to conventional settings used for ESD or POEM. In the fourth technique, which is commonly used during endoscopic submucosal dissection procedure, the knife is completely retracted and applied to the bleeding site. In the fifth technique, novel devices are used. For example, a bipolar dissection device is being used which cuts by use of radiofrequency current and coagulates with the help of microwave ablation current. The ceramic tip of the bipolar device is applied to the bleeding site and microwave coagulation activated. Since this is a bipolar device, there is minimal collateral damage. To summarize, these are the various techniques described in this series of video. To conclude, we described various techniques which effectively coagulate large blood vessels using electrosurgical knives. Each method exploits distinct electrosurgical principles, that is, distance control, adjusted power settings, and under saline coagulation, providing versatility and adaptability to various clinical scenarios. We acknowledge that further studies are necessary to validate the comparative safety and efficacy of these methods against traditional coagulation forceps-based approach.